This animation will help you navigate adult social care and wider public services. It shows how collaboration across health and social care adds value in terms of quality. Health systems are complex, made up of commissioners and providers at both local and national levels. We know that health is dealing with a number of serious challenges, including hospital bed pressures, access to emergency medicine, and capacity within primary care, to name just a few. Social care can be more difficult to define. Local authorities are key players in adult social care. They commission services and provide assessments of needs for adults and their carers. In comparison to health, the provider landscape in adult social care is highly complex. Over 90% of the care commissioned for adults is delivered by independent provider organisations, made up of a mixture of large national organisations and much smaller local or regional companies. They can be for-profit, not-for-profit, or of charitable status. Each local authority area will have multiple providers operating in their area, potentially hundreds. Care providers employ around half of the entire health and social care workforce. So where to start in terms of engaging with providers? The good news is that many areas have care associations in place. These are made up of representatives of local provider organisations and offer a single point of contact. But what do the general public, the people accessing and experiencing support, make of it all?
When we use the term navigate the system, the image that I get is an object. It's not personal. For me, health and social care is very personal. It has a lot of emotion attached to it, especially for me, because the life that I want, I need support. I need support to enable me to have that.
When we talk about adult social care, we shouldn't forget communities. They are filled with amazing people, groups and networks which have grown organically to fill a local need. There's a great deal of potential to be nurtured and unlocked within communities. So what could happen if health and social care work together? Hospitals need to focus on helping people to get home as soon as they no longer need hospital care. Similarly, social workers and care and housing providers need information from hospitals to support people to return home safely. Making this work properly can't really happen without everyone being around the table together as equal partners. Care providers face huge daily challenges recruiting and retaining staff, but support from partners in health and the local authority could impact positively on workforce challenges across a number of providers. Access to mental health services can be a real challenge for health and local authorities. Collaboration with the voluntary sector can provide access to expertise, for example from organisations like Mind, and could result in community assets becoming a recognised part of the support available, so that people aren't alone whilst they wait for specialist mental health support.
It's not just about the processes, the policies or the practices that you create. It's about people. It's about our lives, our aspirations, our dreams, our hopes. Common sense isn't necessarily common practice. And leaders being brave. And we say that quite flippantly, being brave, but any culture is situated in beliefs, attitudes and behaviours that are formed to lead the organisation to do what it does.
Just think what great things could be achieved if the expertise and assets from each of these parts of the health and wider social care system could be combined. What could have greater potential to deliver improved quality and to transform people's lives?